Hello class, and today we're going to talk about cardiopulmonary resuscitation, or better known as CPR. CPR and the steps you can take and how to recall how to administer or aid a child or an adult with CPR. So one of the things that we can think about is the abbreviation or the 3 C's, and the first of the 3 C's is check. So we're going to check our surroundings for safety. We're going to check the person nearby. And if it's a child, we are going to check for a parent or guardian and obtain consent, as well as ask them questions such as, is this child allergic to anything or has taken any medication at this time that could have caused them to have difficulties breathing or gasping? So we're going to check for the safety of the area and for consent. Afterwards, we are going to check if the person is conscious during this time. And we can do that by doing the shout and tap method. So we will shout, "Are you okay?" And we will tap the person. "Are you okay?" So use the shout and tap method to see if this person is still conscious and able to answer questions during this time. Because if you think about it, while you wait for the emergency response system, this person may no longer be able to answer any questions. So this is a great time to ask questions such as, again, do you have an allergy? Have you currently taking medications? Are you choking? And after we check our surroundings, we obtain consent, and we check on the person. We are then going to call. So the second C is call. We are going to call 911. And now you can do this by having someone else call, and make sure you're directing you call 911 versus yelling it out to the crowd. And if this is you and you may be alone, you can call 911. You can place the phone next to you on speaker and allow the operator to walk you through and count your compressions during this time. So we're going to check, and then we're going to call. And then the third one is we're going to care. This is where we're going to go ahead and administer CPR. Now, one of the ways that we can administer CPR is hands only. So during this time, especially the pandemic, if you don't wish to use any kind of breathing technique, you can do hands only, and you're still going to use the 30 to 2 method. We're still using 30 to 2. So that means we're doing 30 chest compressions. We're going to do 2 breaths, and we're going to repeat this 2 times within 2 minutes to a minute. Other techniques that you can use is you can think about 101 compressions per minute to the song Staying Alive. So staying alive, staying alive. It's another way to keep count of your compressions. Now, to make sure that this child or adult is gasping or may have something caught in your throat, we're first going to lay them on their back if they're not already on the surface. Then we're going to go with one finger to the center of the forehead. You're going to tilt their head back. This will naturally open their mouth and clear their pathways for breathing. If this is a child, you would take your fingers and you would pinch the nose to make sure that the air is flowing straight into the lungs. And at this point, you can put a thin layer of fabric or a covering in the mouth if you're going to do breaths, or if you're going to administer hands only. When moving forth to administering your compressions, you're going to use the heel of your hand to the center of the chest, and you're going to do cross line, center of the chest, heel. If it's adult, you're going to do double hand to make it heavier. If it's a child, you're going to use one hand for compressions. And when you're working on your compressions, as you push in, make sure you're allowing the chest to rise once again. As you push, allow the chest to rise and then form your compressions. Remember, we're going to do 30 compressions and then give 2 breaths. And we're going to do mostly soft and long breaths. So and you may be able to see this in the stomach. So if you're holding the person's stomach or in their chest, you'll see their chest rise as they are taking in the breath into their lungs. And remember, you can also do, like I said earlier, rhythm of a song like Staying Alive, or you can have second person count your compressions for you, or do the compressions as you take the 2 breaths. And at this point, hopefully you have some emergency assistance when performing CPR on a child